Susan, what do you think the biggest challenge is for healthcare systems and hospitals right now?
You know, in healthcare, there are a lot of moving parts, and I think many healthcare providers are experiencing similar issues. But one of the things that we're experiencing is the affordability of care for our patients. We are in a very rural part of Wisconsin. We have a very old population, a very sick population, and our average household income is much below the national average. So when you think about that challenge, that's something we have to address head on, because our patients are having more and more out-of-pocket costs for their health care, and as a result, even though more are covered, they're not coming in to be seen in the way they should for their wellness care, their preventive health care, or even their ongoing monitoring of some of their chronic illnesses.
So how does healthcare technology play into that?
You know, healthcare technology is very important, and what it does is it gives the information at the point of care. So over time, if you can have that information when you're actually interacting with a patient, whether it's in the office, in the hospital, or through a virtual care model, you can do what's best for the patient because you know about the medications, their medical history, and tests that have been completed. So it's much easier to see the patient and do what's best for them because of the availability of the information at that point.
Well, we know there are a lot of policies and regulations that are impacting how clinicians deliver care and how healthcare technology can be implemented. If you could change one policy, what would it be, or make one impact or one change in terms of the federal regulation? What would that be?
You know, actually there are a couple things, but they're linked. And when I think about how health information technology has impacted patient care, let's just look at the number of patients that are using wearable devices or sharing information remotely with their physician offices or their healthcare team. So it's important not just to get the information to the team, it's also important that they can analyze it and then report it back to the patient in a way that is impactful or helps their outcome. Probably the biggest barrier to that evolving further is the payment model, and something that needs to be addressed. And that does tie into virtual healthcare as well. We know that patients are not wanting to drive long distances for their care. They don't want to leave work in order to see someone on their healthcare team. So if we can address that policy and really have the payment model catch up with the delivery model, we'll be in a much better place.
So you're a longstanding member of the eHealth initiative. How has eHealth helped you over the years address some of these challenges and barriers? What role do you think it can play in the industry?
You know, eHealth has a huge voice in Washington. We're a small organization, but the representation from the stakeholders across industry has really caused us to think about what purpose we're here for, which is to serve the patient.
I'm going to ask you one more question. So if you had to describe healthcare technology, the current state of healthcare technology in one word, what would you say?
Chaos.
Great, thank you.